Welcome to Tocilizumab Chronicles Beyond the Cytokine Storm, a podcast where we explore the science and impact of this medication in immunology. I'm your host, Dr. Shikha Agrawal, ready to dig into details with Prachi Virat, our microbiology green thumb with a passion for bioinformatics. In today's episode on Calming the Storm, Tocilizumab's role in managing cytokine release syndrome. Welcome to the show, Prachi. Let's navigate through the facts and findings.
Thank you so much for having me back. It's always fun to connect and share insights.
Let's start with the basics. What is cytokine release syndrome and what causes it?
Sure, Dr. Shikha. Cytokine release syndrome, known as cytokine storm, is a life threatening condition caused by an overactive immune response. It can also occur in response to infections, certain medication, or therapies like CAR-T cell therapy. The immune system releases excessive cytokines, leading to inflammation and organ damage.
Wow, that sounds intense. So, how do doctors usually treat cytokine release syndrome and keep it under control?
Treatment often start with supportive care, things like relieving symptoms, helping the organ function properly. But in more severe cases, doctor may use medication like tocilizumab to calm down the overactive immune response and bring back inflammation under control.
That's where tocilizumab comes in. Can you explain how it helps in managing cytokine release syndrome?
Tocilizumab targets the IL-6 receptor, which play a key role in inflammatory response. By blocking IL-6 activity, tocilizumab can help reduce the severity of cytokine release syndrome and prevent organ damage.
What makes tocilizumab effective for this kind of immune reaction?
Tocilizumab had been shown to reduce the inflammation and improve outcomes in patients with severe cytokine release syndrome. It often used in patients who don't respond to other treatments or have severe symptoms.
Are there any specific considerations for healthcare providers when using tocilizumab to manage cytokine release syndrome?
Providers should carefully monitor patients for sign of improvement of potential side effects and adjust treatment accordingly. Timely intervention is critical in managing cytokine release syndrome.
Before we wrap up, what's the current understanding of tocilizumab's role in managing cytokine release syndrome?
Tocilizumab is a valuable treatment option for managing severe cytokine release syndrome. Ongoing research continues to redefine its use and explore new applications.
And with that, we wrap up another great conversation. To our wonderful audience, thank you for joining us for another deep dive. Follow, share, and stay tuned for more insightful episodes coming your way. Till then, stay curious.